Alright guys, welcome to my YouTube channel. Now in this very video on students request, I am quickly going to discuss about retinoscopy. Now this retinoscopy is the objective method of verification of refractive error in the patient. Yes. Now refractive error verification can be done in a subjective way as well. You are already aware of that. That is via Snellen's chart. The patient is sitting at a distance of 6 meters. The patient closes one eye and starts reading from top to bottom: 6 by 60, 6 by 36, 24, 18, 12, 9 and 6. That means the patient is telling you that he is seeing. Here you don't need the patient to speak to you. You don't need the patient to tell to you. You just do it by your own side. Okay. All right. Now, first, before I proceed further, it is very important for you guys to understand how it is done. Yes. Now I'm going to quickly show you the real patient video so that you have an idea, so that you have a feeling of sitting with me in my dark room and doing retinoscopy. So check this out. So I am doing retinoscopy. First, the room should be dark and there can be different positions from which you can do retinoscopy. It can be 66 centimeter, it can be 1 meter. The most commonly used method is retinoscopy from a distance of 66 centimeters. That is approximately your one arm distance. So it is 66 centimeter. So what I do is I first part the streak of light on x-axis. So this is your x-axis. Then there is a rotator. I'll rotate it like this. Then I'm going to pass at y-axis. Yes. So the same thing you are seeing happening in this video. So this is along the y-axis. And okay. So having seen this, now I am going to show you something else. Yes. So this is how retinoscopy is being done. So there are three principles in the retinoscopy, provided you do it from a distance of 1 meter. The three principles are: if you pass the streak of light, let's say along the, you are passing it along the x-axis. Yes, you look out for the red reflex. What is red reflex? You must have seen when you take the images from the camera using the flashlight, you can see red eye. What is that red eye, boys and girls? That red eye is actually the reflection from the retina. Hai na? Now when you are projecting the streak of light on the retina, so there is the same reflection of red light. And when you move this streak of light from, say, I'm moving it from my left to right, then right to left, left to right, right to left, and I look out for the red reflex which is coming from the retina and what is its direction. Now suppose I'm moving it along the x-axis, but the reflected light which I'm seeing moves opposite to that. That actually tells me that the patient is having myopia more than 1 diopter. Okay. Now if I pass the streak of light from one side to other side and there is no movement of the red reflex which I am getting, that will tell me that there is myopia which is 1 diopter. Okay. Now if the movement of the red reflex is along the movement of streak of light, that will actually tell me the patient is either myopic, less than 1 diopter, hypermetropic, any diopter, or emetropic, no refractive error. Yes. Now let's see. I am just going to show it to you. So if the light is being projected on the retina, so you can see that there is no movement of the red reflex. Hai na? Now if the patient is hypermetropic, check out the point of focus which is behind the retina. Hypermetropic, yes, and you can look out for the reflected light. Can you appreciate the reflected light? So it is moving with the movement of the streak of light. So streak is moving here to here, and and the red reflex is also moving in the same direction. But when you start placing the plus glasses, yes, because the plus glasses are convergent glasses. Convergent means biconvex glasses. So it is going to shift the point of focus nearer to the glass itself. Here in this video, you can see on placement of the biconvex glass, the point of focus is being shifted from behind the retina to on the retina, Further, if I increase the power of the plus glass, it will further shift the point of focus from on the retina to in front of the retina. Now you can see earlier it was moving with the movement of the streak of light. Now since the light is now focused on the retina, so there is no movement. But when I further increase the power of the plus glass, which is convex glass, you will actually see that the movement of the red reflex will be in the opposite direction, just the way you see in this animation. Can you appreciate that? So this is what I was trying to explain to you. Have you understood this? So check this out. Okay, now I'm going to take one example quickly. I'm going to fast forward it now. So on x-axis, you can see what? You can see that the red reflex is actually with the movement of the streak of light. That actually tells me that the point of focus is behind the retina. So to bring that point of focus from behind the retina to on the retina, I am going to place plus glasses, boys and girls. So first I'll do it in x-axis, then y-axis. Both are with the movement of the streak of light. So I'm going to place the plus glasses, and the point of neutralization will be the point at which there is no movement of the red reflex on passing the streak of light, x-axis, y-axis. Yes, still you can see it is along the movement of the streak of light. So that means I need to increase the power of the plus glass. Yes, further you can see, but you can see that the reflected light is becoming more beautiful. It is becoming more bright. That actually tells me that I am moving towards the neutralization. Yes. Okay, now it is stopped. So that actually tells me that at +3 diopter placement at x-axis, the point of focus is on the retina. Now I am going to do the same at y-axis. Now here you can see that now it is moving against the movement of the streak of light. That actually tells me I have put up the power which is more. The point of focus is now shifted in front of the retina. We don't go for +1, +2, +3 such that, you know, we go for +3, +3.25, +3.5 like this. This is just for description purpose, just for your understanding purpose. Yes, don't simply start with 1 and directly switch over to 2, directly jump over to 3 and directly jump over to 4. No, you have to go slowly and steadily, 2, 2.25, 2.5 like this. Okay, so this is one thing. Okay, let's take another example. Now again you will place plus glasses. Yes, and you will increase the power again. Okay, still it is moving along the movement of the streak of light, both at x-axis and y-axis. First we'll conceptualize this, then we are going to solve the numericals. Yes, okay, again you can see that the reflex is getting very bright. It is getting very beautiful. And let's try increasing the power and see where the reflex is going. Oh, it has become opposite. So that means +4 power is the power of neutralization. Okay, all right, so I hope you have understood this. Okay, now I am going to be a little more conceptual. Now can you tell me what is the definition of myopia? It is very simple. Myopia is when the image is formed in front of the retina. Yes, no, there are two more criteria which has to be included in the definition of myopia. First criteria is the light ray should be coming from infinity, number 1. Second criteria is accommodation should be at rest. Yes, now when I am doing retinoscopy, now I am not going to sit in Chandrayaan and land up on the moon and will start shining retinoscope from Chand. No na, I'll have to be at a distance of either 66 centimeter or 1 meter, which is the most commonly used distances. Yes, now if I am at a distance of 66 centimeter, yes, that means that the light ray, this is a point source. Yes, so from this point source, the light rays are not parallel, they are divergent. Have you understood? Now see, I'm just going to draw it for your better understanding. So myopia is when the light rays are coming from infinity and they are being focused in front of the retina while accommodation is at rest, isn't it? But when I'm doing retinoscopy, and what I'm doing is I am throwing the light from this point source. So the light coming from this retinoscopic bulb is not parallel, my dear friends. It is divergent. So this will be leading to one error. Divergent light rays such that the power of the eye will be used first making the divergent light rays parallel, and then it will be focused, so it will not give me correct power. And second is, you are at a distance of 66 centimeters, so you are watching towards the retinoscope. So you are watching towards the retinoscope, which is just at a distance of 66 centimeters, say 1 meter. There will be accommodation which will be set in, so you will not get the absolutely correct power. So there be some error. So two errors are there. One is due to divergence of the light rays because retinoscope is near to the patient. Second is because retinoscope is near to the patient, there will be accommodation, but the definition says accommodation should not be there, accommodation should be absent, and the light ray should come from the infinity. So for that you go for two corrections. What are those two corrections? Those two corrections, one is your distance correction. So boys and girls, distance correction is the more near you are to the patient, the more deduction you will do. Suppose you are doing a retinoscopy from a distance of 66 centimeter, so you are going to deduct minus 1.5 diopter from the neutralization value. Yes, if you are doing retinoscopy from 100 centimeter or 1 meter, you will deduct minus 1 diopter. Yes, okay, because the more near you are, the more divergent light rays will be and the more deduction you will apply. In simple terms, what if you are doing retinoscopy from 50 centimeter, you will deduct minus 2.0 diopter. This is your previous year question, but retinoscopy is mostly done from a distance of either 66 centimeter or 1 meter. So this is one correction which you will apply. Now the second correction, the accommodation. But for that, what you can do is you can simply ask the patient to look at a wall behind you. But if you are asking the patient to look at the wall behind you but not in the retinoscope, of course the accommodation will not be there. So the false error, the false power which you were thinking would come in the form of an error would not be there, but it will be difficult for you to do retinoscopy. Why? Because one is accommodation, which will lead to what? Constriction of pupil, increase in the anterior curvature of the lens, and convergence. Yes. Second is pupillary light reflex. What is pupillary light reflex? When you will shine the light into the patient's eye, so both pupil will constrict. If both pupil will constrict, you will not be able to appreciate the red reflex which is coming from the retina through the pupil. It will be difficult for you. So what you do is you use a cycloplegic agent. What is cycloplegic agent? Cycloplegic is you paralyze the ciliary muscle, because you know ciliary muscle cause accommodation. So you will paralyze the accommodation. Yes. Now what is the correction that you are going to apply? Of course, you are going to put mydriatic eye drops, the cycloplegic eye drops, and you are going to ask the patient to look into the retinoscope itself. Yes, but there, because of cycloplegia, first, there will not be any accommodation. Mudda solved. Second, added advantage, the pupil will be dilated, so you will be able to appreciate the red reflex clearly, and you will be able to appreciate the point of neutralization as accurate as possible. Yes. Now what are the cycloplegics which you can use? First is atropine. Atropine 1% eye ointment is generally used in children because it is the strongest cycloplegic agent, and in children the cycloplegic strength, the ciliary body is very, very strong. So you need to use the strongest possible cycloplegic agent. So it is used in children. This is your previous year MCQ. Atropine 1%, or you can use homatropine eye drop. Homatropine eye drop. You can even use cyclopentolate. Yes, or you can use tropicamide. So you are paralyzing the accommodation, na? Okay, you have paralyzed accommodation, but did you realize something? that the normal tone of ciliary muscles are also gone. You just wanted accommodation to not happen, na? So you had put the cycloplegic drug, which has completely paralyzed. This cycloplegic drug will not only stop accommodation from happening, but it will paralyze even the normal tone of the ciliary muscle. So for that extra loss of normal tone of the ciliary muscles, you will do correction, because atropine causes the entire loss of the normal tone. So you will deduct -1 diopter, because 1 diopter is the maximum tone of ciliary muscles. Homatropine, it decreases 50% of the normal tone of ciliary muscles. This tone of the ciliary muscle is 1 diopter, which is from birth since death. Yes, so you will deduct -0.5 diopter. Cyclopentolate -0.75 diopter. Tropicamide -0.25 diopter. Is it understandable? So these are the two corrections that you are going to make. I hope it is understandable. Okay, now let's do numericals. Now you have understood the basics of retinoscopy, right? Now let's do numericals. So suppose you performed retinoscopy from a distance of 1 meter and you used homatropine eye drop. So the point of neutralization at x-axis was +4. At y-axis was also at +4. So this was point of neutralization. Now you will not prescribe +4 diopter of the glasses. You will first apply the correction, because you had done retinoscopy from a distance of 1 meter with homatropine. So for 1 meter, you will apply correction of -1. This is distance correction. And homatropine, of course, the accommodation is abolished, but it has also abolished the normal tone by 50%. So -0.50, its corrective value, -0.50. So net and net, you will get +2.50 +2.50. Yes. Now, since it is +2.50 both at x-axis and y-axis, so you will use which glasses? You can simply go on for +2.50 diopter sphere. So there are two types of glasses. So one is sphere, another is cylindrical. The difference is that sphere glass is going to act both at x-axis and at y-axis, while cylindrical glass is only going to act at one axis. So here at both axes you require +2.5 na. So you can use sphere because it is going to act in both the axes. So you will give +2.5 diopter sphere. Okay, can I step up a little bit? Let's do that. Instead of +4, let's take here +6. Now apply the same corrective values. So +4 -1 -0.5 -0.5, then +6 -1 -0.5. So now final power which you will give is +2.50 here, but here +4.50. फंस गए यहाँ पे. अब क्या करेंगे? अब देखो, we have got different powers at two axes. So at x-axis you have to give +4.5. At y-axis you have to give +2.5. So what you are going to do? So you can give +2.50 diopter sphere. Sphere, I told you, is going to act at both x-axis and y-axis. So this y-axis will become 0. But here you require +4.5, but you have given +2.5 diopter sphere. So +2.5 will be nullified at x-axis. So remaining will be +2.00, because sphere is going to act both at x-axis and y-axis. So now after giving 2.50 diopter sphere, I am left with extra power of +2 diopter at x-axis. Yes, but boys and girls, mind you, while placing the cylinder, you always place the cylinder 90 degree at where you require the respective power. That means if you require the power at x-axis, you will not place cylinder glass at x-axis. You will actually place the cylindrical glass at y-axis. Why is it so? I am going to tell you in a little while. So you require +2 diopter of cylinder, na? So you will give +2 diopter cylinder at, you will say, sir, x-axis 180 degree. No, I told you, you always place it on the other axis. So you will give cylinder at 90 degree. Why is it so? Check this out. Conceptually, if I place the cylinder at x-axis, so cylinder will be like this, na? This is a cylinder. Yes. Now, if I place it at x-axis, so these are the curves of the cylinder. Curves, 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 curves. Remember, if the curve is like this, so it is going to act at this axis. So if I place it at 180 degree, so the curves are along the y-axis. So that means the effect of the cylinder will be at the y-axis. But if I place the cylinder at 90 degree, I am placing it at 90 degree. Yes. So you can see that the curves of this cylinder is along which axis? Along x-axis. So the curves are like this. So it is going to act at x-axis. So we require +2 power at x-axis or y-axis. We require it at x-axis. So we are going to place the cylinder at 90 degree. Or we can use another equation. What is the other equation? Check this out. We can give +4.50 diopter of sphere. So this +4.50 diopter has become 0. But my dear friends, we required +2.50 diopter at y-axis. But we have given sphere +4.5, which is covering both x-axis and at y-axis. So that means at y-axis, we have given extra +2 diopter, isn't it? Yes or no? So we will give -2 diopter cylindrical at y-axis. So if we require to give at y-axis, we are going to place the cylinder at 180 degree, boys and girls. Is it understandable? So basically the simple funda is, whatever power you are given in the form of sphere, it is going to act both at x-axis and y-axis. If you are giving a cylinder, it is going to act as at an opposite axis. Let's take another example. Yes. Okay. So you were doing retinoscopy. So at x-axis, it was -5. While at y-axis, it was +4. You used atropine and you did it from a distance of 66 centimeter. All right. Now, what will be the corrections that you will apply? For atropine, you will deduct -1. For 66 centimeter, you will deduct -1.5 because the light rays will be more divergent. Yes. Okay. At x-axis for atropine -1. For 66 centimeter -1.5. So ultimately, what power you are going to prescribe will be +4 -2.5. It will be +1.5. -5 -2.5. You have to respect the plus and minus signs. It will become -7.5, boys and girls. Yes. Now you have to give the power. So first is, you can give sphere in the form of +1.5 diopter sphere. So by giving this part has become 0. But here you require to give -7.5. But since you have given +1.5 sphere, so this has also become +1.5 for now. So now you have to decrease this +1.5 value at x-axis to -7.5. What power are you going to give? First, you will take +1.5 to 0. Yes. Then from 0, you will go towards -7.5. So you are going to give -9.00 diopter cylindrical at 90 degree. Or 180 degree at 90 degree, because you need to give this power at x-axis. So you are going to place it at y-axis now. All right. Let's take another equation for this same refractive correction formula. So you can give minus 7.5 diopter sphere. Now minus 7.5 diopter sphere is going to act both at x-axis and at y-axis. So it will become 0. And here you require plus 1.5, but you have given minus 7.5 in the form of sphere. So at y-axis you are going to bring the power from minus 7.5 to 0. Then you have to bring it towards plus 1.5. So you will give plus 9.00 diopter cylinder, but you require this power at y-axis. So you are going to place it at x-axis, isn't it? 180 degree, boys and girls. So this is your another thing. Now, can I increase the difficulty level a little bit? Let's suppose after doing everything, after applying the correction, your final power which you have to give it comes out to be plus 5 and plus 4. So this is given to you. And they have asked you which form of astigmatism is this. So what is astigmatism? When there is different power at two axes. Yes, astigmatism. So here it is plus 4, here it is plus 5. So astigmatism is definitely there. What is difference between with the rule astigmatism and against the rule? WTR or with the rule astigmatism is when the y-axis is steeper than x-axis, isn't it? Why with the rule? Because there is upper lid which is pushing the cornea, there is lower lid which is pushing the cornea, such that at y-axis the cornea is more curved. Now you know power is inversely proportional to focal length, means more is the power, less will be the focal length, and also the curvature is directly proportional to the power. So I told you that y-axis is more curved. That actually tells me that y-axis has more power than x-axis, isn't it? That also tells me that at y-axis the focal length is shorter than the x-axis, because y is having more power. I told you power is inversely proportional to focal length. Now coming back to this equation, can you tell me this is with the rule astigmatism or against the rule? Let's solve it. So plus 5 and plus 4. So plus means the image is projecting where? The image is projecting behind the retina. Yes. So two axes, both are behind the retina. So you require plus 5 at y-axis. Plus 5 means you require more convergent glasses to bring the light rays from behind the retina to on the retina. That means at y-axis the point of focus is more far as compared to at x-axis. That is why you require less power to bring the point of focus from behind the retina to on the retina. So that actually tells me the focal length between, that means the distance between the cornea and the point of focus, is more at y-axis or at x-axis. It is more at y-axis. That is why you required more power to bring it from behind the retina to on the retina. Yes, if the point of focus, if the focal length is more, that actually tells you the power is less, or vice versa. Or if the focal length is less, the power is more. Here you require just plus 4 of the glasses to bring the point of focus from behind the retina to on the retina, as compared to plus 5 which you require to bring the point of focus from behind the retina to on the retina at y-axis. So can you tell me this is with the rule astigmatism or against the rule astigmatism? So it is clear cut evident that x-axis is steeper than y-axis. This is against the rule astigmatism. Have you understood? Let's take another example. So this was for plus. I am going to give you another example, but this time I am going to take minus. Okay. So minus 2, minus 3. So what do you understand by minus? Minus means concave glass. Concave glass means divergent glass. So let's take an image. So there are two point of focus. One is this, one is this. So that means if the power is minus 3, -3 means you require more power of glasses to shift the point of focus from in front of the retina to on the retina, as compared to -2. So -2 means that the image is of course in front of the retina, but -3 means it is more in front of the retina. That is why you require more power of divergent glasses as compared to the x-axis. Yes, so that means here -3 means more power. Tabhi to, that is why the focal length is small. That is why you require more power of divergent glasses. So that actually tells me this is with the rule astigmatism or against the rule. So boys and girls, this is your with the rule astigmatism, because the point of focus is more in front of the retina and power is inversely proportional to focal length, right? So these are pretty important questions that are asked in your PG entrance exam. Let that be FMG, let that be NEET PG, or let that be INI CET. So that was it. So now I am going to show you something interesting. So of course I am telling you about the retinoscopy. So but I told you in the beginning, I want you people to have a feeling of sitting with me in my OPD. So I told you that we look out for the red reflex. I'm going to show you how do we see what actually do we see in the eye when we say that okay, this is the red reflex. So I'm going to show you. What I did is I took my retinoscope and I placed my camera behind it, then I did retinoscopy. Now you are going to see this. Can you appreciate the red reflex? Can you tell me it is with the movement or against the movement? It is with the movement of my retinoscope. So I am going to place plus glasses here also. Can you see at x-axis it is with the movement or against the movement? It is with the movement. That means I am going to place the plus glasses till the point there is no movement, and you can also see that the pupil is dilated, hai na? So it is always better to do retinoscopy by dilating the pupil because the chances of error are minimal. So sometimes even if you are doing dry retinoscopy in which you are not using any cycloplegic, so sometimes the patient still looks towards the retinoscope and it can lead to errors. Yes, so first x-axis and then y-axis both are with the movement of the reflex. So plus glass, black glass generally is plus glass, red glass is generally the minus glass. So still it is moving. Yes, okay, so I am going to just fast forward a little bit because I want to show you. Now this is with or against? So this is against. That means probably I have placed more power of the plus glass such that now the point of focus is in front of the retina. Yes, okay, so that was it. So basic idea was to make you understand. If you want to see the entire retinoscopic video with all the real patients, so you can visit my recorded lectures on the app. Okay, so this was it for retinoscopy. Now before concluding the session, I am leaving you guys with one numeric formula. What is this formula? I am going to give you a condition in which you will tell me what will be the final prescription that you will give to the patient. So the retinoscopy was done from a distance of 66 centimeter and the point of neutralization was +3 and -5. It was done from a distance of 66 centimeter and the drug which we used was atropine. Now what will be the final prescription of the glasses that you will give to the patient? You need to tell me. अब आप पूछ रहे होंगे सर ठीक है हम ये कर लेंगे, हमें समझ में आ गया, बट आपको कैसे बताएंगे? You need to WhatsApp me your answer. I'll be waiting for your answers. अगर मेरे पास आपका आंसर आ गया तो मैं समझूंगा कि आपको रेटिनोस्कोपी कॉन्सेप्ट पूरा समझ में आ गया. अगर आपके पास इसका आंसर नहीं होगा, नहीं निकल रहा होगा, कंफ्यूजन होगी, स्टिल यू कैन व्हाट्सएप मी and you can ask me for the answer. I'll try to give you a voice message and will try to explain you one more time, or you can just go back to the video and try watching this video again, right? So I'll be waiting for your answers. And if you are not on WhatsApp, which is, you know, a very minuscule probability, you can also send me a मैसेज ऑन इंस्टाग्राम. अब आप बोलोगे सर ये हो सकता है कि हम इंस्टाग्राम पे नहीं है, व्हाट्सएप पे हैं, बट ये नहीं हो सकता कि हम व्हाट्सएप पे नहीं है, इंस्टाग्राम पे है. बट स्टिल आई एम शेयरिंग माई इंस्टाग्राम अकाउंट विद यू, सो यू कैन फॉलो मी. आई कीप ऑन पोस्टिंग some real patient cases. I keep on posting the rule of two diagnosis. Just go through my Instagram videos, you will realize. So I try to, you know, do rule of two diagnosis where I expect you guys to answer me. I give 2 clues of, you know, etiology, 2 clues of signs and symptoms, and 2 clues of treatment. Then you need to tell me which disease or which sign or which symptom I am talking of, right? So that was it from my side. And yes, take care, and I hope to see you soon in my next video. Bye bye, and love you all.